Thanks, Emma. And thank you everyone so much for joining us this afternoon for this faculty spotlight. As Emma said, my name is Summer Berman and I'm the director of Fresh Start Clubhouse, which is a psychosocial rehabilitation program for adults with serious mental illness here in Washtenaw County. While at the school, I studied management and communities and with communities and social systems at the university, and I received my MSW from the U of M School of Social Work in 2004. I am currently serving and very proud to serve on the U of M School of Social Work Alumni Board of Governors for about 4 years, most recently as our vice president. I currently serve as the chair of our professional development committee, which puts on events very similar to this one, where people are earning CEUs so that we can all maintain that most important licensure. So I know how excited everyone is this afternoon that there will be some CEs involved. And of course, we recognize that circumstances don't allow us to be in person together, unfortunately, but maybe there are some benefits to that as well. My hope is that at least a couple of you in the audience right now are maybe able to attend this session specifically because it's virtual and online, and maybe being in person would have been a barrier to you. So, you know, always looking for those silver linings there. And I also know that many of us are dealing with some kind of Zoom fatigue, but I can assure you that our speaker this session is going to present not only relevant, but also engaging information, and that you are going to be very glad that you are here. So Abigail Eiler is a licensed clinical social worker and educator with more than 15 years of experience working in tribal and non-tribal communities across the country and in Canada. In 2014, Professor Eiler started as a Leo lecturer at the University of Michigan School of Social Work and joined the governing faculty in May of 2018 as a clinical assistant professor. She teaches various interpersonal practice courses to MSW and PhD students enrolled in the school's MSW program, as well as providing instruction in the school's community action and social change undergraduate minor. She deeply values teaching about social justice and implementing its principles into her clinical practice. She utilizes an anti-racist framework and makes intentional strides to address privilege, oppression, diversity, and social justice theories, research, and practice central to her work, social work pedagogy. Her clinical and macro experience are driven by her commitment to child welfare and include family support services, trauma-informed care, cultural humility, and reducing recidivism in the criminal and juvenile justice system. She's worked in many community-based organizations and currently holds a leadership position in the Department of Intercollegiate Athletics. She's supported over $8 million in research efforts over the past 10 years, with emphasis on improving mental health screening and services for youth aged 10 to 24. Professor Eiler played an active role in the implementation of the Behavioral Health Collaborative Care Program in the Department of Family Medicine's Ambulatory Care Unit at Michigan Medicine, and brings that experience into the interpersonal practice in integrated health, mental health, and substance abuse pathways. She's the former president of the National Association of Social Workers, the Michigan Chapter Board of Directors, as well as the chair of the Big Ten Mental Health and Wellness Cabinet, and serves as a member of the advisory board for the Washtenaw County Peacemaking Court. So I am very pleased to introduce Abigail Eiler for our Reunion Week Alumni Spotlight. Thank you, Abigail, for joining us.
Thank you. I am very excited to be here with all of you today. Thanks for tuning in after, I'm sure, a very long day. I hope to make this as engaging as possible and really look forward to telling you a little bit about my present day work here in the Michigan Athletic Department. So I'm going to share my screen and then we'll go from there. Okay. So today I'm going to talk about something that's very near and dear to my heart. As Summer shared, one of the things that I have spent a lot of my career doing is working in integrated care settings. And so when the opportunity came for me to return to Michigan athletics, it was this whole concept, this driving force of the Harden model, which I'm going to talk about today. This is actually this is the first time it's ever been presented on, and I'm so thrilled to share it with all of you. And how that's taken place here at Michigan Athletics and how it continues to grow across intercollegiate athletics. So just a little bit about the life of a clinical social worker in collegiate athletics. So I am on the faculty in the School of Social Work. My appointment is 100%. I do a lot of fun stuff in my appointment while I'm teaching. And then I also have a project buyout here in the athletic department, which allows me to, one, continue to practice, and then also to design programming that's consistent with what is needed in the field and to produce the best outcomes for our students. So just to kind of get a climate for all of you, if you could tell me a little bit about whether or not you all are interested in sports before we get going.
Perfect. So again, like I said at the beginning, please participate in the polls if you're planning on obtaining CEUs. And if the polls are not working for you, feel free to put your response in the chat. I'm going to give you guys a couple more seconds. We have just about everyone responding.
Okay, so it seems like there's a significant number, about 81% of y'all that are interested in sports and about 19 that are not. So my hope is that those of you that are, you can kind of enjoy and embrace all the work that we're doing here as sports social workers. And those of you that are like, that's never really been my interest before, that you're hearing things that are consistent with either your practice, or maybe even you have some thoughts, feedback, and recommendations about how to continue to improve the work that we do here at Michigan and throughout the NCAA. So a little bit about today's objectives. First, making sure that you all learn about 3 different services that sports social workers provide within the collegiate athletic settings. And then also looking at identifying at least 2 common ethical dilemmas that sports social workers experience when working in collegiate athletic departments. So I wanted to start with a case example. There was a student athlete that was ranked number 12 in the country in their sport as a junior in high school, and was injured. At that time, the student was carrying a GPA of 3.96, had been identified as having a photographic memory, which did not return after 2 back-to-back head traumas. From a 2-parent household, both parents and 3 siblings were all Division I collegiate athletes. First concussion, diagnosed concussion was on October 16th. Second diagnosed concussion was on October 17th. The first one was actually in a weightlifting accident where the weight plate broke and came down and crushed the student athlete's left side of their face. And then the following day, they were rear-ended in a car accident, leading to frontal head trauma and then ricocheting back with whiplash. So the recommendations at that time for the student athlete were to take 2 weeks off of school, try and keep the lights low or off, to have no academic or athletic or extracurricular activities, so no participation in day-to-day functioning that the athlete had been used to, and then to be woken up every 2 hours. So we do have a poll for this, and I would like you all to just check what you feel would actually be the recommended services for this teenage student athlete. So we have mental health evaluation, physical rehabilitation services, maybe speech therapy, maybe even the recommendation to end sport career or retire or other. So just go ahead and check as many as you feel maybe in the best interest of that athlete.
Okay, I will give you guys a little bit longer to respond to those. Again, please respond to the poll, and if it's not working for you, go ahead and use the chat. Okay, I'm going to end the poll, and here are the results.
Okay, so, I think this one speaks to our profession, right? This recommendation, 96% of folks saying a mental health evaluation would be important and necessary. The other thing is that physical rehabilitation services are highly recommended here. Speech therapy, 15% of people saying to end maybe sport career or retire. And then 40% of people saying like, maybe there's some other recommendations. So I would love to hear you all's recommendations if you want to participate by adding that to the chat. So a little bit about this story in particular. The reason that I share this case example is because it was my own experience. So I was a former collegiate athlete. I also played professionally. I was on the US national team back in the 90s, the late 90s. But when I was a junior in high school, had back-to-back concussions where I ended up losing my speech. I was, kind of in this weird place. And one of the things that was never offered to me at the time was any type of social work services, mental health evaluation, or assessment. Now, what happens when you take someone who's used to training several hours a day, being extremely active, and you put them in a dark room and tell them not to do anything? Well, what essentially it can do is it's going to promote a depressive episode, right? And so I had no kind of understanding or awareness of what I was experiencing at the time. And luckily, was able to have some really great supports in my life at the time where the depressive episode resolved and I didn't have lingering symptoms. But as a junior in high school, when your whole life gets turned upside down and such a huge part of your identity is sport, you're not really sure where to turn, what to do, and then if there is light, at the end of the tunnel. So what I recognized at that time was that as I continued my sport career, I was going to make sure that I was very vocal about concussion and prevention injury, that it would be critical and essential that people who experience symptoms similar to mine were also able to have access to counseling services or mental health evaluations and social work intervention. And so that's one of the reasons why I came back to collegiate athletics. A lot of people will ask me this question because when I started my social work journey, one of the things that I spent a lot of time doing was working with youth. Most of the youth being ages 10 to 17. I worked in different youth programs. I worked for the Washington County Children's Services Juvenile Detention Facility, where youth were awaiting adjudication. So I did a lot of work with juvenile justice. And what I noticed at the time was that the same youth were leaving and coming back, and same youth were leaving and coming back. And the recidivism, I noticed that there were different components and things that were missing. And it was that whole concept of family systems and structure and how that influences and impacts outcomes for children. So I was talking to Denise Starripple, who's also a former graduate of the program, and she said, Abigail, I really recommend that you return and you get your MSW. And at first I was like, I had always kind of thought about going into the social work profession, but didn't realize that I would, just take one gap year out of undergrad after graduating from Michigan as well, and enter the program. So I dove right in, graduated with my MSW in 2006, and have have never blinked an eye about wanting to have any other profession. I feel like this has always been a natural fit, and always something that's that I hold very near and dear to my heart. Um, when I was in the program, one of the things that I did was I worked very closely with Dr. Kathleen Colborn-Fowler and Dr. Robert Ortega at the Family Assessment Clinic, doing forensic interviewing with Dr. Fowler's model, the extended child interview assessments for child sexual abuse cases and maltreatment cases, as well as treatment. And after I finished, one of the things that I decided I wanted to do was I wanted to go and work with tribal communities, because it's an identity that I carry, and wanted to make sure that I was giving back to communities that I came out of. And so I went out west to the Southwest. I lived in Arizona for 4.5 years, and worked in different specialty clinics. So I did family preservation and reunification, really with a heavy emphasis on child welfare. I worked in a trauma clinic that specialized in reactive attachment disorder. And then ended up getting married to my high school sweetheart and moving back to Michigan to have our first child, again, coming back to the family assessment clinic for a brief period of time. And the interesting thing that I noticed through my social work journey since leaving the program and graduating was that regardless of where I went and what setting I was working in, there seemed to be this commonality and this interest in sport across the lifespan. So from the very beginning of kids that I were working with that were exposed to substances at birth, right? Their parents were interested in sport, whether it was something that they liked to watch or something that they liked to do, all the way up to when I was working at Michigan Medicine in ambulatory care, and worked with several patients that were in their 70s and 80s and 90s, that had talked about how sport had played such a big role in their life. And I started to realize that my passion for sport had never really left. Now, my experience in undergrad at Michigan was very interesting. There's a couple things that actually stand out. One, I was, a Black Native, young woman who was playing at a predominantly white institution on a predominantly white team, and kind of felt like a fish out of water at times, which is kind of a pun because I was a water polo player. But I had such a strong identity to who I was, and that came with challenges. I went to school during 9/11 and everything that happened after that, where there was an increase in different issues related to race and religion, and it was really unfortunate what our university was experiencing at the time. And as a young woman of color, I wasn't exempt from that. And so my final year at Michigan, we were going through a recertification with the NCAA. And I was the president of our Student Athlete Advisory Council. And I said, I want to sit on the steering committee with, our president and our vice provost and some of our regents and our athletic director to talk about issues related to race and ethnicity. And acknowledge that student athletes have a voice at the table and an opportunity to kind of improve the outcomes for student athletes of color's experiences, because it wasn't easy. And so I think a lot of times people are like, but you made it seem so easy. And there's so many reasons for that I'll get into as I continue to talk about, again, how I landed back into collegiate athletics. So I think one of the things that I always want to make mention of is that, my passion and desire to improve outcomes for student athletes and their college experiences, right? So they are students first, they are athletes second. But making sure that from the moment that we can engage with them that's permissible by the NCAA to when they transition out of sport, there's opportunities to engage, there's opportunities to enhance, and there's opportunities to intervene and hopefully produce the outcomes that are desired and that are identified as being in the best interest for our students here at Michigan. The other thing that I noticed in terms of when I decided to come back to Michigan was it kind of like reignited how sport promotes self-worth and value. And that everyone has a space and place in sport, regardless of race and ethnicity and sexual orientation and gender identity and beyond. That sport really is an opportunity for development in life and as a way to connect. And so we utilize our platform here in collegiate athletics to be able to have these discussions, to embrace change and to promote equity and inclusion. The other thing that I think is really important that helped me land back in college athletics was looking at these opportunities to teach resiliency. So there are a lot of challenges and adversities that come with being a student athlete and going through our experiences as student athletes. And so it's this avenue for skill building that promotes lifelong opportunities for change and wellness. So I get really excited when I look at, my journey back to college athletics and how I, was in juvenile justice and child welfare and family med and all these different things that really prepared me for the job that I do today, because the kids that I worked with in JJ and child welfare and family medicine are very similar to that of the kids in the populations that I serve today. Our student athletes come from all over the world with all different experiences. And so having this comprehensive understanding of people and the human experience has really contributed to my ability to practice, truly practice cultural humility, as well as to honor everyone that I work with in a truly empathic and genuine way. So one of the things that I have found to be extremely helpful when I think about collegiate athletics is understanding how I continue to service those that sometimes are identified as being a vulnerable population. And so I would love to hear you all's response to this specific poll. That are athletes considered a vulnerable population? And just choosing yes or no for this one.
All right, I'm going to give you guys a few more moments to respond. Looks like we've got about 80%. All right, and here are the results.
Okay, so this has kind of always been like a really interesting discussion, determining whether or not athletes are considered a vulnerable population. And so definitely feel free to jump in and kind of give your thoughts and feedback in the chat about your response, your yes or no response. And the reason that I always ask this question is it kind of goes back to what I was saying before, is that our student athletes come from all walks of life, right? With multiple different histories. We have a significant number of student athletes that come from lower SES communities and neighborhoods with different trauma backgrounds. But once they are here, one of the things that's really quite interesting is the unique stressors that student athletes experience that are not consistent with what is experienced with the general student population. Now, I'm not saying that our general student population isn't experiencing stressors, but when I look at some of our student athletes and the critique and criticism that they experience on a daily basis, um, it sometimes can be extremely devastating. Last year, I think one of the things that popped up for me was after we had a young man, one of our football players, drop a pass in the end zone. He started to receive death threats. He was told to leave his sport, that he was no good, that he was worthless to our university. And so our athletes are constantly under critique and criticism, not just by self, not by coach, not by teammates, but by the greater community and population. And so this unique stressor that they experience increases their vulnerability and their risk for mental health related disorders, episodes, and symptoms that can cause a disruption in their daily functioning. The other thing, and as it was noted in the chat, was this, the whole physical vulnerability and stress. Now our athletes train, and this is governed by the NCAA, 20 hours per week. And while we try and keep them to the 20 hours per week, we also recognize that some of our athletes train outside of training. And that's a very small percentage, but we do know that does happen. And so student athletes are again at risk for some stressors that are not experienced by non-athletes. This whole concept of role-related stress also contributes to trying to find balance between the athletic and academic demands, coping with injury, navigating role conflict, maintaining their fitness and their fitness levels. And then also managing any outside activities or responsibilities that they have specific to life and to all that they contribute while they're here at the university. With these different student athlete experiences, one of the things that we notice that can cause such a significant amount of stress for them is time, the time constraints that they have on a daily basis, and how that then impacts a decrease actually in the amount of time that they're sleeping, which then slows down recovery, increases risk of injury, and impairs functioning. So a lot of people will say, Abigail, now that you're back in athletics, like, what are you responsible for? And so I have about 10 hours a week as part of my appointment that is carved out to athletics. It's about 8 to 10 hours a week. But my responsibility with athletics exceeds that. In essence, that while I have these 10 hours allocated that I am in the office, working with staff, working with student athletes, the services that are available to the student athletes are 24 hours a day, 7 days a week, 365 days a year. The complexity of working in athletic medicine, and in particular, the athletic counseling team, is increasing availability because our athletes are all over the world. So I have oversight of our athletic counseling team, and that's a team of 7, and 6 of the 7 are social workers. That is part of the Harden model that I'll be talking about today. I'm also the Chief Diversity Officer, so I'm working collectively with coaches and staff and student athletes on the Year 5 strategic planning goals that just rolled out for the school's diversity, equity, and inclusion plan that we've been working on, and we're getting ready to enter. We just had a meeting today about entering DEI 2.0, so we're really excited that this will continue, the plan will continue. As Summer said earlier, I do chair the Big Ten Mental Health and Wellness Cabinet, which has been a great opportunity to provide education and start doing some data collection and getting research related to student athlete mental health and wellness services. In our conference yesterday, I had the opportunity to speak to all of our athletic directors. And then in a couple of weeks, I'll be presenting to all the presidents and chancellors throughout the Big Ten about models of care and recommendations to improve student athlete services. As a member of the Anti-Hate, Anti-Racism campaign, so what you'll notice, there's this huge coalition that the commissioner started, and we're doing a lot of work that's specific to education. So I get to like bring my my passion for education and my love for sport and my commitment to DEI initiatives into one space and share that widespread. So we just did a huge presentation on the impact that racial justice issues have had on the mental health and well-being of athletes of color. And then I also serve as a member of the leadership team, consulting on mental health related issues. So I think one of the things that I always like to do in presentations is I like to set the record straight. As it relates to student athlete mental health, the research is really all over the place. And this was one of the things that I found to be extremely challenging when I came back to start working at Michigan in 2017. That one of the things that I wanted to be able to do, and Dean Videka was in great support of it, was figuring out how to look at the system within athletic medicine, look at the social work profession, and how do they complement each other? And then therefore, how can we look at creating research, collecting information that is going to help really advance career and scholarship, right? So that's the one thing that I have found myself doing over the past several months. And more specifically since COVID hit, was I'm just collecting so much research and data that hopefully will be able to make an impact for the profession and then also for the development and health and welfare needs of the student athletes. So when we look at research, one of the things that an NCAA survey stated prior to COVID was that 1 in 4 student athletes reported that fairly often in the past month, they felt like difficulties were piling up so high that they could not overcome them, which led to obviously a decline in functioning. Now, one of the things that we've done here in Michigan Athletics, which is a partnership with the Depression Center in athletics, as well as formerly the School of Public Health and now the School of Social Work, has taken on the research initiatives and lead. But through this study in 2014 with Dr. Eisenberg, who's now at UCLA, but used to lead the research team through the School of Public Health, collected a whole bunch of data, and that data reported it. It showed that 63% of student athletes had indicated that their emotional or mental health issues affected their athletic performance within the last 4 weeks. Now, we just repeated this study at the middle of 2019, and we noted that the number had risen to 72%. Now, there's a couple of reasons, for that. One is that we've worked aimlessly to try and support and reduce any stigma related to mental health so that we could improve the well-being of our student athletes at the university and beyond. So the Athletes Connected program, which was originally funded by the NCAA through one of their innovation grants, looked at 3 different things. One, to increase awareness about mental health and wellness services. 2, looked at promoting health-seeking behaviors and coping skills. And then 3, provided resources to improve mental health functioning. Now, with these things, we looked at this prevention model of education and awareness being accessible to our student athletes, making sure that we can capture them on different forms of media. So whether that be on Facebook or on Twitter or through video on YouTube, hosting different sessions related to identifying signs and symptoms of mental health disorders. And then from that, created support groups, more specifically wellness groups for student athletes to come in, learn skills, connect with one another, and then those that desired to receive clinical care or met the criteria for a mental health related disorder and were referred by a physician or an athletic trainer for medical care was something that became increasingly available and needed. So when Greg Harden started back in 1986, he was a one-man show, and he was coming in part-time as a consultant for the football team, talking about alcohol and other drugs while he was working in a hospital-based program in the Ypsilanti area. And the one thing that he had noted that was essential, that was critical to the needs of student athletes, was this whole idea of collaboration, increasing communication, and then furthering that conversation through research, which is actually what ended up leading to additional efforts in collaboration with other entities here on campus much later. So when we looked at Greg Harden and his experiences here at Michigan, we decided that it would probably be most impactful to kind of capture how did his journey begin and what has been his focus. So I'm going to start by playing this video, and then I'm going to start talking about the Harden model and what that's done here at Michigan and how we're seeing that roll out across the country.
The real mission.
I don't know what just happened, so we're going to try that again.
The real mission, my objective, my obsession is to help people become the world's greatest experts on one subject, on themselves. One of the things that I emphasize and teach, if your life is going to work, it's going to be because of your decision making, your ability to have healthy relationships, and to be able to take total control over what you can control. First order of business is trying to be in control of your thinking, your decision making, problem solving, and how you interact with others. So 17 to 23, that age group is a terribly exciting group to work with, because this is when you get a chance to let the adolescent child begin to take a back seat to the young adult. If you want to be the best, you have to develop yourself in more than one area. Can you imagine having a young person in my office and trying to explain to them they could be a better athlete if they're a better person? Trying to explain to them, if you fight to be the best academically, you increase your chances of being the best athletically. That's a tough sell sometimes, but you have to push people to understand that everyone comes with baggage. There's stories in our industry, in our lives. There's stories with our peers. There's stories with young athletes who are the absolute best, all-American this and all-American that, who turn out to be human beings struggling with the same things that everyone else is struggling with. Understand that the NC2A, the Big Ten Conference, conferences all over the United States have put an emphasis on mental health. And what we've discovered is how crucial it is to have a variety of folks that people can talk to, who look different, have different backgrounds. And we've done an exceptional job of making a commitment to making sure that our students had access to a wide range of specialists, people who specialize in anxiety disorders, people who specialize in eating disorders, depression, people who are comfortable with the range of issues that these students bring. I'm so excited about what it means to have the type of team that we have. And as our athletic director indicates, if the center of the target is the student athlete, then we're moving in the right direction.
Okay, so hopefully folks were able to hear that. If not, I will try and turn my sound up. That might make a difference if your sound's not all the way up on your computer or device that you're utilizing. I know sometimes videos can be very tricky when we utilize them through Zoom, so I apologize for that. So a little bit about this whole idea of a Harden model, right? Or what we refer to as the Harden model. It's something that when I think about athletic medicine and this whole concept of an integrated care clinic, there are so many moving pieces and parts. So essentially what we're looking at is it's an embedded system of care model that is coordinating medical and mental health, behavioral health services for student athletes here at Michigan. It is holistic, so it's aimed at treating the whole person and utilizing a multidisciplinary team in order to do so. With that being said, when we look at standard integrated healthcare clinics across the country, the teams are much smaller than what you're seeing here. While typically you would see a patient at the center of care, because of the complexity of people that are in the system and that are involved in providing care to our student athletes, the case manager is typically at the center with the student athlete. Now that either is a social worker, so a member of the athletic counseling team, or it is an athletic trainer who is helping serve as that conduit of care between multiple people. Now, the one thing that I think is super important for us to note is that even though there's all these people that are part of the care, the system of care, that doesn't necessarily mean that the case manager is involved in updating all of them. And that goes back to our licensure law, right? So we have, the same standards of ethical practice and service delivery related to confidentiality and beyond. So those that are outside of our medical team are not updated without the release of information. And that's one of the things that sometimes we run into quite often is that people want to know, how can I help? What's going on? And unfortunately, we're not always able to tell them unless given permission to do so. So when I think about this integrated healthcare model, I'm really looking at this ability to coordinate care, do a comprehensive collective assessment to help meet the needs of our student athletes, creating one treatment plan instead of multiple treatment plans that we often see, and then ensuring that follow-up is completed and that it meets the desired outcomes of the patient, right? So of the student athlete. So when we started looking at this model and all of those that are included in it, so I'm actually going to go through it. So we have registered dietitians, we have a physician extender who kind of is like a jack of all trades, so can serve as an MA, is also an athletic trainer, and has specialty training in different areas for sport. We have a senior associate director, athletic director of student athlete health and welfare, Daryl Conway, who is one of the top athletic trainers in the country. We also have specialty providers, so cardiologists, psychiatry, we have orthopedic surgeons. We've got tons and tons of people that are involved in the student athlete healthcare process. Sometimes a parent or a guardian, the sport administrator, the dean of students. We have a faculty athletics rep that works between the athletic department and the academic part of their care and services and institution within the institution, our athletic director, our team physician, and beyond. So the list goes on and on and on. And when we talk about coaches, we're not just talking about sport coaches, we're talking about also strength and conditioning coaches and performance coaches. So this is really a big team, right? So it's important that we have everybody involved in the process. Now, while this looks very similar to many athletic medicine teams across the country now, this is something that was not seen up until the last 10 years. There was a lot of disconnect, a lot of functioning in silos, which was producing higher cost and lower outcomes for the desired outcomes for the athletes. So when we looked at the Harden model and the origins of it, it was actually developed off of an EAP model. So what does that really look like, and what does that actually mean? Well, because it was based off an employee assistance model, the intention was to create a space in place for student athletes and coaches to receive confidential services. Now, for our coaches, we don't provide psychotherapy for them, but we do a lot of consulting, a lot of education on how to support the health and welfare of our student athletes, with an emphasis on their mental health and well-being. In addition to that, it created this space that went far beyond what Coach Schembechler had initially asked Greg Harden to do back in the 80s and in through the mid-90s, which was to focus on alcohol and other drugs. What Harden set up was a place for people to focus on work-life balance, right? So the work of being an academic, the work of being an athlete, and combining all of that with the joys of life, right? So all these different domains. We have social functioning, we have physical functioning, we have all these different areas that Harden said, these students, athletes, they don't have balance. And so it created a space for that to happen. Also, to be able to talk about relationships, substance use, legal concerns, financial concerns, to have a space in place to be able to do those things. What we have noticed at Michigan has produced improved outcomes for our student athletes. It's actually increased graduation rates and has increased retention. So there's a lot of things that go into that. What we're getting ready to study right now is cultural and linguistic competency as it relates to recruiting and retention efforts as well. So there's all these things that within this integrated care model that we can continue to look at so that we can improve, right? So we can improve services, so we can continue to support our student athletes as they evolve during their time here at the university. When Harden introduced this, similar model, what I call it is a EAP lookalike to athletics, it really provided this opportunity for us to increase our training and consultation services. One of the things that we just did on Monday was we trained all of our coaches on mental health signs, symptoms, and indicators. And then also crisis intervention. So what is our emergency action plan? What would happen if a student athlete discloses that they're having thoughts of suicide? And more specifically, what happens when they're displaying suicidal behaviors or symptoms that are consistent with a major depressive episode, and they're not directly stating that they're suicidal? So we had a very thorough conversation on Monday about how do we create a suicide safer community. These are all things that we're now seeing roll out across the country, that we're actually, aiming for supporting our student athletes and their health and wellness first, as opposed to really focusing on advancing their athletic performance while they're here at the universities. So there's some complexities to looking at student athlete identity. And when we think about role engulfment theory, we think about the rigidity that comes with the student athlete struggling to identify as just a student, or sometimes, a teammate and beyond. It's their identity is so intertwined with who they are and how they function, that when our student athletes experience something like an injury, whether that be a season-ending injury, something that's brief, or maybe it's career-ending, that transition out of sport creates some complexity and can sometimes result in mental health-related challenges, difficulties, and sometimes disorders. So that through this athletic medicine integrated health model, we've been able to be respondent to the needs in a more comprehensive way. So when we look at social work roles as it relates to student athlete health and welfare, This is one thing that I think a lot of people are very shocked at, but something that was very intentional when we looked at this concept of the Harden model, that social workers shouldn't just exist within athletic medicine, but social workers should exist beyond athletic medicine, so that we had people that really understood the person in the context of their environment in all different domains of the student athlete experience while here at Michigan. So while in athletic counseling, 6 of the 7 are clinical social workers, and I have 1 neuropsychologist that works with us. We also have social workers and social work students that work in Athletes Connected, which is the program I talked about earlier. This summer, we launched a program called Coaches Connected that has multiple social workers that are providing the education for our our coaches underneath the Harden model. We also have other social work staff, equipment, sport administration. Our athletic director happens to be a graduate of the MSW program at Michigan, Ward Manual. Our academic advisors. We have 2 academic advisors, one that is just wrapping up their MSW experience and education at the School of Social Work here at Michigan. We have a video analyst that is an MSW student who is employed full-time in the athletic department and has been here for several years now. A director of operations, and we did a survey and found out that we even have one of our sport coaches has a BSW. So it's been quite phenomenal to be able to coordinate and to have these conversations with social work staff all throughout the athletic department on varying levels, and to talk about how they're contributing to the health and welfare of our student athletes during their experience in time here at Michigan. So why do we utilize this approach? And I think when we look at the research for integrated care models, we found a lot of parallels. And we found that by utilizing the Harden model as an approach, it was accessible to student athletes and each other. We are embedded, right? So we have had a social worker embedded in athletics since the 80s, which is something that we were not seeing in counseling services across the country for decades. And it's actually been quite remarkable to see how it's developed and evolved along the way. When I returned to athletics in 2017, it was a 3-person show, and now we are a team of 7 just within athletic counseling. So as we increase our accessibility, it's actually increased the likelihood of our student athletes reaching out and getting the help that they need. It is patient-centered. So everything that we do is specific to the student athlete need. Within athletic medicine, we are really focused on what the student athlete's desired outcomes are. We understand and we recognize that sometimes the coach will say, well, I need them back, or I want them back, or how can I support them in their journey? But our student athlete plays a pivotal role in developing their treatment goals and outcomes. And that is something that the Harden model really embraces, because what we often see in collegiate athletics is that sometimes the influence that a coach may have on medical providers can cause detriment to the health and welfare of students. And it's something that is not tolerated here at Michigan by any means. Our athletic director and our president of the university have both made it very clear that the medical team is the overseer of student athlete health and welfare and their medical care and any decision making there. But we put the patient at the forefront of that with the Harden model, very similar to that we see in other integrated care models, or patient-centered medical homes is what we often refer them to as. And then in terms of continuous, so this whole idea and notion of don't drop the ball, with obviously in sport, that's a pretty important metaphor that we utilize quite often, but we utilize this approach so that we don't drop the ball, so that everybody's in the loop, that can be in the loop, and that's going to be part of the plan that has been identified by the student athlete and by the medical team, which makes it comprehensive and coordinated. And I think one of the things that I've really embraced is that it's compassionate and it's culturally effective and responsive. That we're looking at different ways of providing intervention to our student athletes that maybe we haven't seen as standard forms of care. One of the things that we're looking at right now, and I'm writing up a study on with one of our physicians, is she has just started utilizing acupuncture to try and decrease anxiety-related symptoms in our athletes here on campus. So when we think about the research and we think about mental health in athletics, there's a couple things that we need to note. One is that about research suggests that about 3/4 of those who have been diagnosed with a mental disorder, such as anxiety or mood disorders and beyond, have their first onset by age 24. So one of the things that you heard Greg Harden say was from 17 to 23, this is a very pivotal stage in time in the health and welfare of the athlete or of the young adult. And so what we really recommend and do quite often is we teach our coaches and other people to assess and refer, that when they're seeing something to say something, right? And to not wait for symptoms to worsen. So we always say, like, ask early and ask often is one of the rules that has been outlined in this model. Looking at the pros outweighing the cons of maybe an athlete not being able to participate in sport. The pro is always going to be to take care of their health first. The other thing that was really interesting that we identified with the American College Health Association survey findings was that about 30% of the respondents had reported feeling depressed in the last 12 months. And so making sure that through this research and data that we provide education on what does it mean to be sad versus what does it mean to experience a major depressive episode or another mental health related disorder. And do people know the difference, right? And then 50% of folks reporting that they felt overwhelmingly anxious. Now, anxiousness is something that we hear quite often, right? When we think about performance anxiety in school, we talk about test anxiety and beyond. And so being able to identify nervousness versus anxiety is something that has been pivotal for the student athlete to understand, but also all those that are part of the system. And so in order to do that, what we have really embraced is this concept of providing a full spectrum of care. So this is where that whole idea of sports social workers and sports specialization really shines and comes through, is that we are providing care to student athletes across the development of those that are experiencing more severe and persistent mental illnesses, to those that are coming in that are looking to optimize their performance. So doing more of that performance coaching, and we utilize a model that came out of Ohio State. Go figure, right? Ohio State University, and Jack Lezak, who is a sports psychologist, developed a model related to 9 mental skills training. Now, the interesting thing about the 9 mental skills that Dr. Lezak identified was that, we're looking at confidence, we're looking at motivation, we're looking at self-talk, we're looking at all of these things that we know help everyone perform at an optimal level of functioning. And so we embrace that as part of the Harden model, as a way to support all of our student athletes, not just as athletes, but as students and as developing young adults. And so this whole idea of being able to provide a full spectrum of care is not that we're waiting for people to reach out until they meet the criteria for a major depressive disorder or for any mental health related disorder. We want people to reach out at any point in time. So sometimes it's just to consult. I think Harden says it best when he talks about, Bill Gates, billionaire. Do we think that he doesn't consult with people on how to utilize his money, what to invest in, what to spend time on, and beyond? Our athletes should be functioning the same way. Use your consultants, use your opportunities to develop yourself, beyond your identity as an athlete, so that you can optimize your overall performance in life beyond sport. One of the things that's pretty unique when we look at the athletic brain is all of these things that can really, influence one's performance and influence just one's day-to-day life. So this whole idea of high-speed decision-making, focus and concentration, reaction and anticipation, emotional regulation and relaxation, all of these things are things that our athletes are trained to do quite regularly as part of sport. And so we really take these different ideas and then help them apply that to different domains in their life, increasing mood improvement and overall functioning. This is another video. So this is a student athlete that recently graduated, someone that's very near and dear to my heart, Mira Shane, former goalie on our lacrosse team, who decided that one of the things that she wanted to leave our institution and the athletes that were to come after her was this whole idea of taking care of your mental health and welfare or wellness. And that the transition to college is something that helps you transition through life, and to be very cognizant of how you utilize your supports. And so I'm going to play her video as well, and would love to hear you all's feedback on this, because this is something that is newer to our videos for Athletes Connected.
Dear mental health, I wanted to take the time to say thank you for being strong even in the hardest moments. I have always wanted to push myself, to stay busy, not having the chance to breathe in order to be the best person and athlete I can be. When Mom and Pops dropped me off at South Quad that faithful move-in day, I denied you were not at your best. But let's be honest, freshman year is not easy being away from home. It took me a while to settle into my groove, to get into a routine, to create a new life that was no longer high school. The expectations were high. I needed to perform and be at the top of my game to show everyone I could do this. I need you to know I was trying to get better. I am still trying to get better. Trying to save shots, being a wave of positive energy. Singing in my a cappella group because these are the things that make me, me. I realized it was okay to feel overwhelmed. To keep up with school, lacrosse, a social life, it's not supposed to be easy. You see, mental health, I needed to ask for help sooner. From my pals around me, to call the people I love, and also to find the people here at Michigan that can help me. Through self-reflection, journaling, my growth has risen to the surface, and you, mental health, are the key to our success. I believe in being me, my most authentic self, to be the best version that others can count on. For I know my road has been hard, with a few bumps, but this weight on my moped was not meant for me to carry all on my own. It has taken me this long, from freshman and now senior year, to realize that it's the people surrounding me that are the ones getting me through the tough times. It's these people that have shaped my story, giving me the strength to keep smiling, giving me the power to keep saving. And it's these people that I am forever thankful for, because they are the ones who remind me to just breathe.
So one of the things that we have done through collecting information and different data from our student athletes is figuring out what are their highest needs. And so going back to this whole concept of an embedded model, working together within sports medicine, I said, we're not tracking, our student athletes from when they come in to when they leave. And I said so every single year, our athletes have to participate in what's called pre-participation physical examination in order for them to be cleared to play. And I said, let's look at, utilizing different screening tools to capture things on the way in so that we can be more preventative as opposed to having to be reactive. And so this was something that over the last 3 years is kind of like taken storm and been embraced and really helped identify student athlete needs upon entry. And so it's been embedded into the Harden model as a way to support our student athletes. So we're looking at depression, anxiety, alcohol, and other substances, as well as trauma. Now, the one thing that we were like, okay, now that we've got all this stuff, what within the Harden model do we need to ensure that we have in order to meet the needs of our student athletes? So Greg Harden had already established the concept of individual psychotherapy. He was already doing performance coaching, both on an individual, group, and team level, and doing mental health skills trainings. So again, we added the assessment, we added the group psychotherapy side of things. The team building sessions were there, but continued to grow and skyrocket over the past several years. We're doing standardized return to play evaluations, and that's something that the Mental Health and Wellness Cabinet has really made a lot of strides on over the last several months. Neuropsychological testing was something that you never saw within athletic departments. You did see some clinical psychologists that were doing testing for ADHD, but now what we're seeing is within the Big Ten, there are 2 neuropsychologists that are able to do additional testing, then referring out to other places for ongoing recommendations, medication, and beyond. And by referring out, what we do here at Michigan is we utilize UHS, so our University Health Services, as a way for one, checks and balances to make sure that there's a division behind recommendations and implementation for a student that may need SSD services. The other thing is when we look at like, how do you access services? Well, before it was self-referral, it was coming from the coach and sometimes coming from the team physician. We've advanced that as part of this model to make sure that there is no wrong door, no wrong entry in order to initiate care. So we've continued to evolve along the way. I think an example that comes up for me a couple times is, how does this model actually work? And what happens if there's a student athlete that is in crises and they're getting ready to leave for a team trip, right, for competition? And we always say that if there's ever concerns about a student athlete's mental health and functioning prior to travel, all you need to do is contact someone on the athletic counseling team. That goes back to that lovely 24/7, 365 approach that I had shared earlier. Because then either a member of the athletic counseling team, the physician, or the psychiatrist is going to be able to determine, one, if the student athlete's able to travel, right? And then also that if they are able to travel and we need to create some sort of prevention and or safety plan, then that is done and communicated to the medical staff member that's traveling with the team, which is typically the athletic trainer. What sometimes will happen is that someone will say, well, I want to know what's going on so that I can feel confident and comfortable with, the student traveling or my child traveling or, whoever wants to inquire about it. And so it kind of puts us in this dilemma, right? Is that if we're looking at safety, we know that as long as there's not any imminent risk, right, in that moment, that information should not and cannot by law be shared with other people. And so we really uphold to our ethics and values there. Now, the one thing that was very prominent when Greg Harden rolled out his model was solution-focused therapy. Since then, what we've done is we've added a bunch of different modalities within the model to be able to meet different needs of our student athletes. One of them being cognitive behavioral therapy. We utilize a lot of ACT, right? So acceptance and commitment therapy. We do DBT, but right now, because we're not able to do our DBT groups, we have referred student athletes out to receive so that they can participate in DBT skills groups. We've also increased our use of EMDR, which is interesting because when we look at bilateral stimulation and EMD, not only is it being utilized for trauma intervention and response, it is also being utilized to increase performance and to enhance performance, working on, making connection between those adaptive memory networks. We do biofeedback training for our athletes to reduce anxiety, increase muscle strength, and decrease muscle fatigue and pain. We utilize restorative yoga and then the high performance skills training. So one of the things that I think is important for us to talk about is how COVID has impacted our student athletes. So when our student athletes were headed to March Madness and all of a sudden the event became canceled, it was a shock to, I think, our entire country, but more so to those that experience this rapid loss. So the one thing that our counseling staff did was we attended all the team meetings, discussed the cancellation of winter sport and the postponement of spring sports, and then eventually the postponement of fall sport. So think about that, 7 providers, 31 teams, and it took a lot of coordination, care, and support. And we started to hear a lot of like, who am I without sport and what does this mean for my identity, which I alluded to earlier. The one thing I think, and I'm going to talk about in a moment, is that at the time that sport was canceled, there wasn't a lot of data that was being captured. And so it really was a lot about us reaching out and ensuring that each individual, each student athlete was safe, each student athlete's needs were met, whether that be financial. Athletics serves as a food security and housing security space and place for our student athletes that are low income. And so, we have to ensure that all of those things are being met while also staying within the NCAA rules and regulations. And so what we started to see, over the span of COVID, several months, was the NCAA started putting out data that they had collected. And so they looked at a little less than 38,000 student athletes across all member conferences. So we're looking at each division as well. And 1 in 12 had reported feeling so depressed that it was difficult to function. And then we were also looking at rates of mental health concern experiences for 150 to 250% higher than historically reported by any other study. So a couple things that we recognized were helpful were that 90% were communicating with teammates multiple times a week and 60% were communicating with teammates daily. And so creating an opportunity for those things to happen became very important for us here at Michigan, because we saw such a significant increase in athletes feeling overwhelmed, having issues with sleep, feeling exhausted, feeling alone, and all these things that required intervention and response. So we ran into another ethical dilemma, of course, because we have over 950 student athletes that reside in over 30 states and are from over 12 countries. And so there was this whole, when the university moved towards online education for winter term, and the recommendation to go home, right, if that was possible, that looking at the abrupt end of care, like how do you engage in a continuation of care, what happens across state lines, and then what are the financial implications? Because the one thing that I think is important to note is that March Madness produces about $1 billion in income. So that's about 70% of the income for the NCAA, and a very large percentage of that income goes to the member institutions. So there were huge financial implications for collegiate athletes. And the one thing that our athletic director made very clear was that it will not impact their mental health and their medical needs. So that if we needed to provide care with folks across state lines, that would be a triage and a referral. So my question to all of you is, would you continue to provide care to a patient or client if they had to quickly uproot, relocate, and transition to a new temporary provider?
This is our last poll, so make sure that you do complete it. And just a reminder, if it's not working for you, please do utilize the chat. And I also just want to make a quick reminder, if you guys have any questions, please do put them in the chat box and in the Q&A, and I will make sure that Abigail answers them. So I'll give you guys a few more seconds with this poll. And here are the results.
Okay. And so this was a huge dilemma for us. Reason being is that we can't practice across state lines, but we also are obligated to do no harm, right? And less harm. And so rapidly, what we decided to do was work towards temporary licensure in other states. We also worked with different members of the mental health cabinet and created a provider listserv of over 500 licensed folks across the world within a week, and really aimed to establish a community of care network. The one thing that we were told by both general counsel as well as our medical director was that if a student athlete calls in there in crisis, it's kind of that Hippocratic oath, right? If we need to respond, but because we can't be on site to provide that service and care, and the restrictions of practicing over state lines, which were not allowable unless we were temporarily licensed, that it was important to be able to create other opportunities and forums for our student athletes to continue to connect and meet their needs. So what we did was skill building groups that were very specific to education that anyone could participate in, that were not therapy groups. Also creating other encounters for student athletes to come together, and responded to things in that nature. But that was one of the most difficult things, right? Is that someone reaches out and they say that they're struggling and they're across state lines. And so it was just being very clear on what type of support we could provide, when we could provide it, and then how we could get them linked to the right folks. The other thing that was really important to note is that with the cancellation of sport, we saw a lot of like Kubler-Ross's stages of change model rollout. So this denial of like, this can't be happening. I can't end my college career like this, to bargaining, like, if I return, can I have my scholarship? Will I have my scholarship? To people feeling very overwhelmed and alone and missing folks, to I need to rein in. And this is also from the Harden model, that concept of controlling the controllables. And more specifically, achieving a place of acceptance of like, I'm going to do my best to stay home and stay in place for their greater good, which our student athletes took a very active stance on. And I'm really proud of them for how vocal they were and how they utilized their platforms in order to convey that message across the world. So we found ourselves having to help them adapt to isolation and utilize those resiliency skills that I noted earlier, adjusting their perspective, helping them recognize that their identity hasn't changed, right? That maybe they weren't actively participating in competition, but that they were still student athletes, and they were always, if they were graduating, always a member of the Michigan family. The idea, like I said before, of acceptance, and then creating effective new learning trainings and structures in their home environment. This was an opportunity for our athletes to really explore who they were outside of sport. And then we continue to look at different things like how do we provide services that exceed best practice guidelines, and continue to advance sports social work practice and athletic counseling efforts and initiatives across the country. How do we continue to bring together Michigan Athletics, the School of Social Work, and the Depression Center for research and scholarly development. And I continue to get really excited about all that's to come on that. But one thing that we always have to think about is, are we staffed optimally? And so that continues to be something that I have a conversation with our athletic director and quite often. So what else do we do? Lots and lots. Trainings, on-site performance coaching, research. I hope you all have an opportunity to look at the the Athletes Connected website. And then looking at developing social justice and racial justice frameworks for our coaches. I always say one of the foundations of the Harden model is to be wise with our words, intentional with our treatment planning, and collaborative within our approach to produce the best results and outcomes for those that we're here to serve. And that's one of the things that I think is so important as social work professionals, is that our commitment to service is to those that are vulnerable, which, as you all now have learned, are the student athlete populations across the country. I couldn't do this without this team, so I always like to give a great shout out to the team, and would love to take any questions with our remaining few minutes.
We do have a question in the chat box regarding state lines. I would think that it would be like taxes on internet purchases. The provider is not traveling or moving over state lines. They are still providing from the state where they are licensed. Should we be able to deny consumers the ability to Zoom a provider in another state? Suggested talking to lawyers about this.
Yeah, so we did. We spoke to many. And we're told that wherever the patient resided was where we needed to have our license. And I think, we run into this a little bit as well, because we will sometimes travel with our teams. And we are a provider on the road. And so one of the things that I'm working with right now with the Big Ten Mental Health and Wellness Cabinet is, how can we create this community of support like we did during COVID when people went home, so that if someone from Nebraska is here and there's a mental health crisis and emergency, that the athletic counseling team here or CAP steps in, provides triage and then referral, so that a student athlete or just any student or fan for that matter isn't going without intervention, because that's important, right? We don't want to see people suffer or struggle in silence. And so it is our duty to respond and to serve. And that's something that I think is really important. So Chris, I appreciate you bringing that up, because, I like to kind of push back and say, like, but what about this? And so I've done that a lot over the last several months. Any other questions?
I have a question, actually.
Yeah.
So I noticed that you have an MSW intern on the team. Is there a reason that there isn't a program for this at the School of Social Work?
A program for what?
So a pathway for like sports social work.
Yeah, so we've actually discussed it quite a bit, because one does not exist in the country. And so one of the things that I'm working on with the Continuing Ed office is actually creating a 32-hour CE certificate, which will include other members of the faculty. One of our recent retirees, Bill Vanderwell, and all of his contributions to the field. So it is in the development. And it's something that we can continue to look at. I think we really kind of wanted to establish interest and get the curriculum together, and then we can go from there.
Thank you. And Bill is on this call as well, or on this webinar. So glad to hear that you guys are collaborating. We do have another question. First of all, she wanted to thank you for this presentation. She mentioned that there are so many resources for athletes. Is there an equal or similar level of care for non-athletic students at Michigan, or thoughts in extending these outside of athletics?
Yeah, so I mean, I think, that's one of the things that has definitely evolved over time is that Todd Sevick, who is the director of our counseling and psychological services at the university, they now have embedded counselors in each department, so in each school and college, which is something that they worked really hard to achieve. We have one within the School of Social Work as well, and he's absolutely phenomenal. Alejandro Rojas, we get emails from him quite often, and our students seem to really appreciate having access to a mental health provider within the school, and specifically a social worker, because he is a social worker as well. So yes, I mean, so CAPS has an after hours line. They have access to psychiatry through UHS. So there are definitely a lot of different things that are similar, with the distinction of the sports specialization that we have at Michigan. So yeah, it's quite the crosswalk between the two.
Great, thank you, Abigail. So we have about 1 minute left. It doesn't look like we have any other questions. So I just wanted to thank Abigail for doing this presentation. We really do appreciate it. And I know our alums love seeing what all of our wonderful faculty are doing. So I really do appreciate you taking the time out of your very busy schedule to spend this evening with us. And before we sign off, I want to remind everyone that we will be closing out our virtual reunion week tomorrow. We have at 11:30 to 1 our all-class virtual reunion gathering, and the dean will be giving a state of the school remarks. And so I'm going to share the registration link in the chat. So if you have not registered yet, please make sure that you do. You will need to register in order to receive the link for that. So let me get that in the chat for you. And here we go. So thank you everyone for attending. I'm going to leave this open just for a second so you guys can access that link. But have a wonderful evening.
Thanks, y'all. Go Blue. Try and catch the game this weekend if you can. Put a lot of work into ensuring that it was a safe way for our athletes to play.